What type of birth control do you use?
Birth control, also known as contraceptives, is a method a sexually active woman uses to prevent unwanted pregnancies. And there's a wide variety for women to choose from.
Because being a woman is complicated.
But don't worry, we're going to give you a crash course on all the different methods, so that way you know which one is right for you. There are 3 categories of birth control for women to choose from, and they include the following: the barrier method, hormonal, and surgical implantation. The first form of birth control we're going to talk about is an IUD, or intrauterine device. An IUD is a device that is inserted by a healthcare provider into a woman's uterus and can remain there for up to 10 years, depending on what type a woman gets. The device works by disrupting the way sperm swims, so that means they can't reach the egg to fertilize it. However, one of the biggest downsides of getting an IUD is putting it in, as it hurts a lot. Another popular form of contraceptive is taking an oral contraceptive, also known as the pill. To use it, the woman gets a prescription from her local pharmacy and takes 1 pill every day. The pill works by using a combination of the hormones estrogen and progesterone to work together in preventing the release of the egg, the change in the lining of the uterus, and changing the mucus of the cervix. This makes the uterus inhospitable for sperms that enter it. An interesting fact about the pill is that its effects can also be used to treat menstrual pains, also known as dysmenorrhea. In fact, this is what the pill was originally marketed as back in the 1950s. Condoms are worn by the male partner during sexual intercourse. However, female condoms do also exist. To put on a condom, you simply roll it down the length of the penis's shaft. When worn correctly, the condom has an 83% success rate in preventing pregnancy. And for all women out there, know that when a man says he's too big for a condom, that is false, as demonstrated with this paper towel tube. Hey, what?
Stop! I don't know what this sexually deviant cat has been telling you, but they're all lies. No one should be having premarital sex or sex at all, which is why the most surefire and appropriate means of birth control is abstinence, which is to refrain from having sex. The only time we should have sex is with our partners, and even then, on special occasions.
What? That's not what I'm saying at all.
But do you deny it? You are purposely promoting people having unprotected sex. And frankly, it's rather inappropriate, wouldn't you say?
Hey, there's no reason for you to be a total bully about abstinence. I'm not saying it's anything bad. Just don't censor me for talking about other options.
All right, I admit it. I was rather harsh, and I'm sorry I called you a cat. But the thing is, you do need to tell people that not every form of birth control has a 100% guarantee in preventing both pregnancy and STDs. The thing with abstinence is it eradicates any probable chance.
No, I understand what you're saying, and thank you for adding your input in this, and I agree with you in some parts. A good rule of thumb for birth control is the more a woman has to remember to use it or take it, like in cases of pill or condom, the less effective they are.
Just remember to inform people about the complications and issues relating to every form of birth control.
Noted. Thank you again. While she is right about the 100% effectiveness rate, it should be also stated that areas that teach abstinence always do have a higher rate of having teen pregnancy. But she is right, however. Not all birth control is 100% effective, and each form of birth control does carry some risk to it to the woman, whether that's pregnancy or in some cases with hormonal birth control, blood clots. Some of the other adverse effects associated with taking a hormonal birth control include hypertension, gallbladder problems, persistent leg pain, dyspnea, sudden blindness, severe pain in your chest, sudden severe headache unlike your usual headaches, weakness or numbness in the arms or legs, yellowing of the skin or eyeballs otherwise known as jaundice, spotting or bleeding in between menstrual cycles, nausea, breast tenderness, headache, again, acne, decreased sexual desire, bloating, fluid retention, edema, hyperglycemia, depression, and weight gain. One of the big issues with women taking the pill, aside from the hormonal impact, is that they run into issues like these.
I forgot to take my pill. Crap, my pill.
See, the issue with the pill is, if a woman doesn't remember to take it every single day while she is sexually active, the pill doesn't have the same effect and she's at a higher risk of getting pregnant. But the good thing with the pill is, if a woman remembers to take it every day, she has a 9% chance of getting pregnant. That means there's a 91% success rate with this form of birth control. Barrier methods are probably the most accessible method of birth control for women, as you can purchase them in most local pharmacies. It should be stated that women should not use condoms or other forms of birth controls that are damaged or ripped, as these can be ineffective. In cases of a broken condom, a woman is at risk for both pregnancy and contracting STIs from their partner. One of the other forms of birth control I didn't mention was fertility awareness methods, or otherwise known as cycle tracking. This is where a woman tracks her period and determines the days of when she's going to have sex with her partner, based on the probability of her ovulation and the chance she might get pregnant during that phase of the cycle. However, this method isn't always the most reliable, especially with women who have irregular periods, and this can leave them feeling like they need to rely on...
So, Mercury is in retrograde, and my star sign is a Scorpio, and I had my last period on Tuesday, 8 Tuesdays ago in April, and that means I'm due to have it today, 3 days ago.
Cycle tracking has one of the lowest rates of effectiveness of any type of birth control, with a 24% chance of the woman getting pregnant. Another one of the least effective methods of birth control is the pull-out method. This method only has a 78% effective rate. However, the most effective methods of birth control are the ones where it's basically a set it and forget it mentality. These include sterilization, an IUD implantation, and the implantation of Nexplanon, or the birth control that goes into your arm, as advertised on TV. All three of these methods of birth control have nearly a 99% effectiveness in preventing pregnancy. I'm sorry, I know I've thrown a lot of information at you. If you still have questions and are confused, always consult your gynecologist or visit a women's health clinic to discuss which method is best for you. Because remember, so the question still remains, what type of birth control do you use?
And is it the right fit for you?